Good evening, ladies and gentlemen. I am Dr. Arun, consultant gastroenterologist from Chennai. Today I am going to share my knowledge about alcoholic liver disease and the spectrum, how is it affecting, how it is more common in India. Regarding alcoholic liver disease, which is the most common disease entity which most of the human beings among Indian population is encountering nowadays. Why is it so common? Because most of them, even more than 30% of the Indian adult men have been taking alcohol nowadays. Among them, females also has been more involved. In India, almost around more than 140 million of population is being taking alcohol. So far has been described. Among them, more than 77% have been consuming spirit, and around 7% have been consuming beer, and 1% have been consuming wine. So most of them have been consuming spirit. That is the main reason the alcoholic liver disease is being more commonly affected nowadays. To discuss, among the people who have been more involved in India is almost 1 in 96 minutes of the population has been dying. 1 person in 96 minutes of the population has been dying because of alcohol liver disease. Among them, the highest percentage of alcohol related mortality is happening in the state of Kerala, because Kerala is very famous for everything. You will be getting anything in Kerala. So most of the mortality is happening in Kerala, and Kerala is meant for alcoholic liver disease. And next to that is Maharashtra and Punjab. They rank in second and third position. So why we need to know about alcoholic liver disease and what is the spectrum which is more common in that? See, if the patient is going to take alcohol, if you are going to take alcohol for a fun moment, and as the day progresses, if you are going to take alcohol daily, so it is going to lead to various complications. That is what I want to analyze my knowledge with you all. Suppose if the patient is taking alcohol approximately 30 ml per day, it is okay, nothing much of complications. But all the men have been sticking to that. Continuously they used to take alcohol, and many of them have been taking alcohol daily. And some persons will be more exposed to, they will be taking alcohol day in and day out without doing any other work. So what is going to happen? As the day progresses, the patient is going to have fulminant liver disease. That is what I'm supposed to discuss with you all now. So as you are well aware, the liver is a major function. It contains almost 500 functions being done by liver, and it is the second largest organ in the human body. You are well aware about that. It is almost approximately around 1.5 kg of the human body weight. So it does approximately 500 functions. So it has to be in a proper manner to be tackled. So it does filtering function, it does digestion function, it takes up vitamin A, D, E, K absorption. Also it will be involved in bile acid absorption. So many functions are being taken care of the liver. So if any potential damage is going to happen to the liver, so what is the lethal comorbidities is going to form? That is the main thinking about my talk today. Suppose if the patient is going to take alcohol for a longer time, the safe limit of taking alcohol is approximately around 10 units in a female and 12 units in a male. If a male is going to take alcohol of more than 12 units, and if a female is going to take alcohol of more than 10 units, the chances of getting the problem of cirrhosis, what is called cirrhosis, is nothing but a liver damage, the scarring in the liver. Can happen if the patient is going to take alcohol for a longer duration of time. Alcoholic liver disease is being mainly classified by 3 major clinical entities. Like, the first initial presentation will be a fatty liver. As 90%, more than 70 to 80% of the population who has been taking alcohol, definitely the patient will land up in a problem what is called as fatty liver. Nowadays, every people is more aware about fatty liver, because that is one of the most dangerous condition which will predispose to any further advanced complications in the liver. So if the patient develops fatty liver, and as the day progresses, even if the patient consumes alcohol daily, the patient can progress to what is it called as alcoholic hepatitis. Suppose if the patient develops a condition called alcoholic hepatitis, the patient can develop to a condition called as cirrhosis. Cirrhosis is nothing but the liver is completely scarred, the liver is completely fibrous, the liver is completely shrinked out. Once the liver gets shrinked out, what is going to happen? Almost the 500 functions you are going to lost. So once the liver gets shrinked out, the major complications can develop. Even after that, the patient continues to drink alcohol, the patient sometimes can land up in cancer. Around 5% of the population who continues to take alcohol continuously daily, more than 15 years, 20 years without any break, they may be having high chances for the patient to develop a major dreadful cancer, what is called as an hepatocellular carcinoma. See why it is so fascinating to know about alcohol. We should learn why. Suppose in a crowd, in a jolly gathering, if you want to have some alcohol, if you are going to take around 30 ml of beer, if you are going to take around 30 ml of beer, it's well and good. But if you are going to take 30 ml of spirit like wine, whiskey, brandy, anything else, if you are going to take around 30 ml of spirit, which is almost equivalent to 100 ml of wine, and that is also equivalent to 250 ml of beer. So if you are going to take a 30 ml of whiskey, you are going to take, which means it's almost equivalent to a 250 ml of beer. So you are supposed to be aware about that. That is the most important thing I want to discuss with you all. And as the day progresses, suppose what is a common clinical presentation? If the patient continues to take alcohol, what will happen? The patient can develop jaundice. Jaundice is nothing but the patient eyes will become yellowish in color, the patient urine will become yellowish in color, the patient as the day progresses, the patient tongue, palm as well as the palate, everything will become yellowish in color, and sometimes if the lesion is becoming very severe, the patient can have itching and other problems also. So jaundice is the most common presentation in a case of liver disease. The yellowish discoloration of the eyes and urine, which is nothing but which is called as jaundice. If the patient develops jaundice, and even if you are going to take alcohol, the lethal damage is going to set in that no one can able to stop that. And suppose if the patient as the day progresses, the other problem, what is the thing which can happen if you are going to consume alcohol for a longer duration of time is, the patient can sometimes develop blood vomiting. In a fine night, next day morning, once the patient gets up early in the morning, the patient develops a massive blood vomiting. What is it called as hematemesis? So blood vomiting will be happening. So we don't know what is the reason, and the doctor will be, the gastroenterologist will be advising you to go for the endoscopy. In endoscopy, they will identify a varices or some other complication for that the patient needs further management. So blood vomiting is one more lethal complication. The patient can develop so many other complications. The patient can develop a brain coma. The condition what is called as hepatic encephalopathy can occur as a complication, and sometimes the patient, even if the liver is going to keep on involved in that, the patient renal, the kidney is also going to lose its function. So if one organ is going to involve, the other organs, most of the other organs is going to involve slowly. Like kidney, you are going to lose the function, the brain function is going to come down, and most of the other organs function is going to come down. So how can you analyze? As a general population, I want to convey the message. How do you know that the patient is being affected? And for example, in your family, if you are seeing a member who is consuming alcohol daily, and if you want to analyze them, if the patient is taking around daily, continuously if the patient takes alcohol and the patient eyes is becoming yellowish, and the patient limbs are becoming very thin, and the patient abdomen will become so enlarged. So what is it called? The entirety what is called as ascites. Ascites is nothing but all the protein in your body is pouring out of the abdomen. So if any doctor is going to touch your stomach, if you are going to put a needle in your stomach, so there are so much of fluid may come out from your stomach. That is called as ascites. So ascites is nothing but a plenty of fluid loaded in the abdomen. So you need to be very, very cautious. Once a patient develops ascites, the patient definitely will land up in a dangerous complication, and finally the patient can go for a death and other manifestations. So to prevent the complications, the patient has to quit alcohol as early as possible once the patient develops jaundice. If the patient develops jaundice and immediately analyzing the symptoms, the patient quits the alcohol intake, the patient response will be very good, and the patient clinical status will definitely improve. So once the ascites happens, what is the problem? The patient limbs, that means the upper limb, the lower limb, everything are going to become very thin, and the chest is going to become very weak, and the patient face is going to be puffy, and you can able to recognize, if you are going to see any patient in the general public, you can able to definitely recognize very well he is alcoholic or not, because he will be having a cherubic faces. That means a puffed up appearance. That is the most common presentation if the patient is having alcohol related liver disease. So he will have a bloatiness in the abdomen, abdominal distension, which means ascites, everything can happen, and the patient sometimes can have a swelling in the chest, which is nothing but a gynecomastia. Sometimes the patient will have edema in the legs. The patient legs will become like an elephant leg. elephantiasis like. So the patient will have a edema in the legs, the patient can develop a scrotal edema, and the patient quality of life is going to completely lost if the patient continues to take alcohol. He couldn't able to do the routine activities, he couldn't able to go for the routine work, and he will be completely bedridden most of the time. That is why we are supposed to say that if you are going to take alcohol, you are going to lose your life, you are going to lose your family, you are going to affect the child, your child's environment is going to go down, and even the social status is going to be affected. And you will be wondering, why I am also taking alcohol daily and my friend is also taking alcohol, but why I am the only one is suffering, he is not suffering? It is not only because how much of alcohol you are taking. It is being associated with so many coexistent comorbidities that suppose if the patient is having thyroid means any swelling which is happening, any thyroid related problem, he may have any coexisting liver disease. The worsening of liver disease can happen in the case of thyroid related patient. Suppose if the patient is having other jaundice like hepatitis B, hepatitis C viruses, if it is there in the patient, he may have worsening of jaundice. He may have early onset of liver disease even if he take minimal alcohol. And suppose if the patient is a female patient, if the patient is female, even if she takes a minimal alcohol daily, there is high possibility for female patient to go for cirrhosis rather than men. So men can able to tolerate the alcohol very well rather than a woman. So a female population definitely not supposed to take more alcohol. That is more dangerous, and it will even affect the growth of the baby. If the lady is pregnant, it is more dangerous to the mother, also to the fetus, also to the baby inside the mother's womb. So you are not supposed to take alcohol if you are pregnant. Female patient supposed to avoid alcohol. And suppose if you are having any long-standing diabetes or any other problem, you are not supposed to take alcohol. If you are having any cardiovascular illness, if you are having any chronic lung disease, these are all the possible comorbidities can happen if you are going to take alcohol. The possibility of further complications, the possibility of major complications will set in earlier. So you should analyze. Don't take alcohol. That is the most important thing I want to say. So suppose if the patient keeps on taking alcohol and the patient develops blood vomiting, as the day progresses, the patient develops blood vomiting, the patient abdomen is becoming more prominent, like you are becoming poverty above and wealthy. That means flourishness, nourishability below the abdomen. So patient will be well nourished below and the patient will be thin above. So that is the most characteristic idioms I want to say. So if you want to if you want to stay healthy, so better stop alcohol. That is the first thing. But suppose if the patient develops any alcohol related complications, that has to be tackled by a proper gastroenterologist, and you need to see a proper gastroenterologist as early as possible. That is the first thing you need to do. Second thing, suppose if the patient daily takes alcohol and he develops a complication, the final damage, what is called as cirrhosis. Cirrhosis is nothing but a scarring which is happening in the liver. If the patient develops scarring, as I told you, the patient can develop ascites, the patient can develop jaundice and multiple complications. Suppose if the patient develops a fluid in the abdomen, the patient cannot able to walk, he will have breathing difficulty, he will have so much of other problems. And suppose if the patient develops all these complications, the first thing what the patient is supposed to do is, the patient not supposed to take a salt more than 4 to 5 grams. He is supposed to restrict his salt intake for less than 4 grams. That is the most important thing. And if the fluid is very high in the abdomen, if the patient is having more swelling in the abdomen as well as in the legs, the patient couldn't able to walk at all, he may need a fluid also restriction. Then you need to take a water intake also should come down. Not only water, any fluid intake has to come down for less than 1 liter per day. It has to be reduced. So these things are all major complications can happen. That is why you cannot able to eat, you can't able to lead a healthy and happier life. So once a problem sets in, you need to be in completely salt restricted diet, no salt at all and no water at all, no fluids, minimal fluids. So they will be having so much of complications and you will be having more worriness that will succumb you to death finally. So better stop taking alcohol. That is the message I want to convey. Second thing, and the patient continues to take alcohol, sometimes the patient can develop a dangerous liver cell cancer. That is around 5%, which is more common. And once these kind of problems sets in, we need to take a proper gastro opinion, and if needed, we need to go for a liver transplantation. And regarding liver transplantation, I will be discussing to you later. And other complications like the patient can develop hepatic encephalopathy, that means the brain is going to coma and you need to admit the patient has to be given, and how to avoid all these complications. That is the main motive for me to discuss. So suppose if you are having alcohol disorder, immediately consult the doctor, and always you need to take small diet, frequent small meals. That is the main thing you are supposed to take, and you are not supposed to consume a large heavy bolus of food, which is definitely not going to happen if you develop a liver complication. But even then, if you are going to attempt, you should not do, which will cause some discomfort in your abdomen. So always you need to take a frequent small meal. You need to take very small portion, but that too every 3 to 4 hourly interval, because when you take a small meal frequently, you will prevent the complication of hypoglycemia, which means the low sugar complication. The hypoglycemia you will be preventing. Second thing, and you need to take the medications properly. What's your gastroenterologist, and you need to take a diuretics, what is called, to remove the fluid from the abdomen. We will be prescribing some medications. You need to adhere to the medications and other things as what your gastroenterologist is going to suggest to you. And immediately, before concluding, I want to say, suppose if you want to tackle about, suppose if the problem is sets in, and if your tummy is going to become big and your jaundice is very severe, your doctor already declared that your status is very poor, and finally you need to go into what is called as liver transplant. Do you know about liver transplant? In India, there are two modalities of liver transplant. Among that, one is by a deceased donor liver transplant, and another is by a living donor liver transplant. So what do you mean by deceased donor liver transplant? Is nothing but if any death person, any accident or any trauma person is going to donate the liver to you, which is called a deceased donor liver transplant, and the brain death patient has to donate the liver. So the volunteer person will be donating the liver, and there will be huge waiting list. You will be in the waiting list. So you are not very sure whether you are going to get the liver or not. So until the patient or any other patient is going to offer you the liver, you need to wait for that. Until then, you should not develop any complications. That is the most important thing. And next to that is living donor liver transplant. Living donor means in your close blood relative, like your father, mother, or your spouse, or whoever it is. So they are going to donate the liver to you. For that, they will be offering plenty of checkups is available. So plenty of investigations we are supposed to do. That investigation workup itself will be cost almost around 1.5 to 2 lakhs. So much of money, expensive, so much of things are there. For a living donor liver transplant, the cost is almost around 25 to 30 lakhs in India, and for a deceased donor liver transplant, the cost is almost around 35 to 40 lakhs, which is happening in India. So do you want these kind of problems to set in? So better avoid alcohol, and don't take alcohol even in social. And suppose if you are alcoholic, so I can tell you some ways how to avoid major complications. Always when you are taking alcohol, take very less of alcohol. Suppose if you are having any intention to do that, don't take more than 30 ml in a day. And always you should consume a good amount of food if you are planning to take alcohol. And don't take alcohol in combination. Like if you are taking beer, don't take brandy. Don't take brandy, whiskey, wine all together in a combination like a cocktail. So don't take alcohol in multiple combinations. Secondly, and don't go for native medication. Don't see local TV channel, don't see local things, and don't go use native medications, Ayurveda. Don't go for that. Unnecessarily you may land up in multiple complications. That is alternative modalities of therapy, definitely supposed to avoid if you don't want to land up in a major complication. And don't take medicines on your own without the knowledge of a gastroenterologist. That is a major important thing I want to convey to you. Suppose if you are having any problem, if you are having one issue and you will be consulting a doctor, they will be giving you some medications. Don't think that you need to take the medications for your lifetime. So you need to consult your doctor often, you need to discuss your problem often in order to avoid the major complications. Suppose if the complication sets in, you need to discuss whether the patient deserves liver transplant, whether the patient doesn't deserve liver transplant, as all the complications as early as possible to be managed. And there are plenty of drugs and plenty of modalities of treatment which is available in the market, that too in healthcare center like Chennai and India. So definitely you can improve your status very well. So don't think that if you take alcohol there is a modality of choice what is called as liver transplant. Even after liver transplant, the chances of mortality is still high. Post liver transplant care is more important than a pre liver transplant care. Post liver transplant, the patient, after you are going to transplant, you are you are taking plenty of alcohol, the liver is gone, they remove the liver, the new liver has been given to you, and don't think you will be normal. You may have further addiction, that is called recidivism. You may go into alcohol again. If you happens to take alcohol again, you will land up in major complication. Second thing, even if you don't take alcohol, if you develop any infections or any other part, you may have major complications, and the liver will finally, the new liver also will finally goes away. So better think that rather than don't think if you are taking alcohol, And even if you do the liver transplant, you are going to lead a peaceful life. And throughout the life, the morbidity, which means the complications, will always you need to face. That is the most important thing. So better avoid alcohol. Do not take alcohol. And if you are going to take alcohol, take very, very, very less, and always try to abstain yourself from alcohol and make India a healthy and glorious nation in the world. Before concluding, I would like to say that doctor has suggested you to take 30 ml of alcohol and don't take it for granted. Which means if you are going to 30 ml of alcohol, doesn't mean that your life is going to be in a peaceful way. As the day progresses, your intake of alcohol definitely will go high. So better quit the alcohol. Quit the alcohol, save your family, save your child, save the nation, and save your health and save your job, and have a pleasant life and have a comfortable environment. And once again, before I conclude, if you develop any complications, better visit a gastroenterologist and never go to native medication. That is the main thing I want to convey to you all. Before I conclude, feel free to discuss any problem, whatever the disease, whatever the illness you have. I am there to help you at any point of time. Thank you very much.